Good afternoon, my name is Alan Koh. Today, my health talk is on lung diseases and how energy medicine plays a very important role in supporting our body's self-healing processes against such medical conditions. Well, a very common disease group in the lungs is called COPD, which is chronic obstructive pulmonary disease. Pulmonary means lung, so it can be COLD. That's chronic obstructive lung disease. Same thing. And that is caused by narrowing of the airways, limiting the airflow to the lungs, and causing the shortness of breath and tightness of chest, etc. What's the prevalence of this COPD disease? Well, it affects about 330 million people around the globe, killing over 3 million of them in just that 1 year, 2011 alone. Economic cost of treating such a disease worldwide is about 2.1 trillion US dollars. Huge part of health department's budget on this particular lung disease. Well, one cause of the chronic pulmonary obstruction is the chronic bronchitis, which is inflammation of the two large airways on the left and right of the lungs. So normal bronchus airway is quite open to air flowing in and out, and look at this one where the muscles have enlarged or thickened, where there's exudates mucus coming out and blocking the airflow lumen, the diameter of that lumen. So it will be very hard for air to flow in and out of this constricted area of the airways, the bronchus. So this is inflamed, enlarged, where the muscles are concerned, and that's why it's called bronchitis. Itis means inflammation. That part will be quite warm to touch, that part will be congested, a lot of fluid, a lot of mucus, expanding the area, and also can be quite painful, like chest pain. Another cause of chronic obstructive lung disease would be the emphysema, collapsing of the walls in between these grape-like structures. And so if it's less grapes, because they open up, they like split and rupture, there's actually not enough surface area for oxygen to go into the capillaries in the walls. So here's a lot of chance for oxygen to go everywhere, but here only limited these few strands, for example, as a diagrammatic type of illustration. So it's not enough blood flow once we got emphysema, collapse of the lungs. What are the major causes of COPD? This lung disease, 90% caused by smoking. The other causes are air pollution, occupational exposure, like those Johor Bahru, Singapore, the Causeway, the custom officers don't wear masks, don't wear oxygen tank, keep on breathing for 9 hours job every day for 6 days a week. All these harmful chemicals, or those who work near factories, the chimney smoke come out, and all those coal miners and so on, they suffer a lot from this occupational hazard, or just simply air pollution. Genetic problems can also damage to the DNA, like too much toxins going into the blood, going into the prostate and ovaries, and damage the egg, damage the sperm DNA. Then they will pass on to children, grandchildren, great-grandchildren, and all descendants. Signs and symptoms of this chronic obstructive lung disease would be the chronic cough and the production of mucus, the sputum, and the shortness of breath, chest tightness. All these can be signs and symptoms of this medical condition. Another sign is the expansion of the chest area for the lungs to enlarge and compensate, which is bad, just like the heart enlarge and compensate, or the heart enlarges and compensate. Also bad news. So you can see from quite a narrow, normal, healthy chest diameter, now suddenly enlarged to that, is actually bad news. So chest deformity increased front to back diameter. Other signs and symptoms of chronic obstructive lung disease is the noisy breathing, the wheezing sound, breathing through pursed lips as if you're whistling, and cyanosis, that means the bluing, the color blue, the bluing of the nails, on the lips, in the case of respiratory failure. That means no more good carriage of oxygen, red blood cells. So yeah, the whole area becomes bluish rather than reddish in color. Well, how does electric energy treatment, also called high electric potentials, also called electrotherapy, help out? When all the cells in the vicinity or even away from the vicinity of the eyes, or of the lungs rather, they are fully charged, it means more oxygen and nutrients will go in to improve and regulate all the metabolic processes of maintenance for healthy organs to be maintained, for repair and recovery. All these are metabolic processes. So improved metabolism simply means improved breakdown of toxic waste and harmful chemicals at the same time as improvement of absorption of oxygen and nutrients. And so all the lung tissues and their functions become revitalized. That's good news. What about ultra-long magnetic potentials, also called pulse electromagnetic potentials, also called magnetotherapy, and now magnetic energy treatment. When you apply magnetic energy treatment to the body, it improves blood circulation to the lungs and to all parts of the body to rejuvenate, making the lung tissues younger again, biologically speaking. And they can perform better when they're younger. So it results in the self-healing of damaged lung tissues as more oxygen and nutrients are being transported there by the magnetic field's improvement of blood supply. Magnetic energy treatment also has this good news about strengthening the immune system to fight germs, to prevent cancer from developing in the lungs of smokers. Germs can, of course, cause mucus production and damage to the lung tissues and so on. And by so doing, and also because immune system can reduce pain, pains also are lesser now in the chest, usually caused by the excessive coughing, when you apply magnetic energy treatment to the patient that has this COPD medical condition. Far infrared, on the other hand, would reduce inflammation. That's what it's good for, just like far infrared lamps, like far infrared saunas, far infrared undergarments, and so on. Because bronchitis is an inflammation, alveolitis is an inflammation, the emphysema part, and then the protective membrane surrounding the lungs is called the pleural membrane, and that can cause pleuritis, inflammation of the pleural membrane. So when you apply the far infrared directly against the upper back of your body, that's where the lungs are situated nearest, then the inflammation, all these itis conditions can be reduced, so the healing will take place even much better. For thermoxibustions are actually two treatments in one. Thermos is the heat treatment. When you apply heat to the upper back, the whole lung blood circulation becomes better. When you heat up anything, blood vessels dilate. Anything would dilate, not just blood vessels. And when they dilate, they would transport more oxygen and nutrients to the lung tissues to repair them better. Not enough oxygen, not enough nutrients means lesser repair. But don't forget that there's also further acceleration of the lung tissues due to the drainage away of the drainage of toxins away from the lung area, and therefore cannot re-enter lung cells to cause this lack of improvement. Another benefit of moxibustion is the unblocking of qi flow in the meridian channels in that area, and this will further energize lung cells and accelerate better lung cell functions and improvements. When you combine all the four treatments together, there's absolutely no option but for this medical condition of COPD to keep on improving over time. Thank you very much.